So, what's the difference between benign prostatic hyperplasia, BPH, and prostate cancer? Today, we're diving deep into understanding BPH versus prostate cancer. You'll learn their definitions, risk factors, development, and clinical signs. First, let's talk about definitions. BPH stands for benign prostatic hyperplasia. The term hyperplasia means an increase in the number of cells, causing the prostate to enlarge. Unlike hypertrophy, which refers to an increase in cell size, hyperplasia is all about cell number. In BPH, both the epithelial and stromal cells within the prostate gland multiply, leading to an overall increase in prostate size. This condition primarily affects the transitional zone of the prostate, which is the area surrounding the urethra. On the other hand, prostate cancer is a malignancy or neoplasm, which means it involves disordered cell growth. Specifically, it usually originates in the glandular cells of the prostate and is termed adenocarcinoma. This type of cancer predominantly occurs in the peripheral zone, which is the outer part of the prostate. Unlike BPH, which is a benign condition, prostate cancer involves uncontrolled growth of abnormal cells that can spread to other parts of the body. Now let's move on to the risk factors. For BPH, age is the most significant factor. As men age, the likelihood of developing BPH increases dramatically. By age 30, there's a 10% chance. By age 60, it's around 70%. And by age 80, nearly 90% of men are affected. Family history also plays a crucial role. If a male relative, such as a father or brother, had BPH before age 60, your risk increases significantly. Similarly, age is a major risk factor for prostate cancer. Stay with me until the end of the video because I'm going to reveal how men can reverse these statistics and avoid prostate problems. However, prostate cancer tends to grow slowly, which means it might not cause significant issues for many years. Family history is also important here. Having a first-degree relative with prostate cancer increases your risk by about 2.5 times. And if 2 relatives are affected, the risk jumps to 5-fold. Ethnicity is another factor, with African American men being at higher risk, especially in Western countries where diet and lifestyle might contribute to this increased risk. Understanding the pathogenesis, or how these conditions develop, is key. In BPH, both epithelial and stromal cells increase in number, leading to prostate enlargement. The transitional zone, being closest to the urethra, often constricts the urinary passage as it enlarges, causing urinary symptoms. Smooth muscle cells in the prostate also play a role by affecting the dynamics of the urethra's contraction and relaxation. The prostate capsule, which encases the prostate, can exacerbate these symptoms by restricting outward expansion, leading to further compression of the urethra. Testosterone and its more potent form, dihydrotestosterone, DHT, are critical in the development of BPH. Testosterone from the testes is converted to DHT in the prostate by the enzyme 5-alpha reductase. DHT is much more potent and promotes the growth of prostate cells. This process explains why treatments targeting this enzyme can help shrink the prostate and relieve symptoms. In prostate cancer, genetic mutations in glandular cells lead to uncontrolled growth, forming tumors. These tumors primarily develop in the peripheral zone, which means they grow outward rather than inward, delaying the onset of urinary symptoms until the cancer is quite advanced. The spread of prostate cancer, or metastasis, commonly occurs through the blood and lymphatic systems, often reaching the bones, particularly the vertebrae and pelvis. When it comes to clinical manifestations, BPH typically presents with urinary symptoms due to its location around the urethra. These include increased frequency, urgency, nocturia, and difficulty starting and stopping urine flow. The bladder may not empty completely, increasing the risk of urinary tract infections. Conversely, prostate cancer often has no symptoms in its early stages because it starts in the peripheral zone, away from the urethra. Many cases are detected through screening methods like the prostate-specific antigen blood test or digital rectal examination. As the cancer progresses, it might cause symptoms similar to BPH, but this typically indicates a more advanced stage with a poorer prognosis. Metastatic prostate cancer can cause bone pain and fractures. In terms of diagnosis, BPH is often identified through clinical presentation and confirmed with imaging studies. Prostate cancer diagnosis, however, requires a biopsy to examine prostate tissue under a microscope. The Gleason score, ranging from 2 to 10, helps determine the aggressiveness of the cancer based on how much the cancer cells differ from normal cells. Treatment approaches also differ. BPH is commonly managed with medications that either relax the prostate muscles or shrink the prostate. Surgical options like transurethral resection of the prostate can remove excess prostate tissue to relieve symptoms. Prostate cancer treatment depends on the stage and may include active surveillance, surgery, radiation therapy, hormone therapy, or chemotherapy. In conclusion, understanding the differences between BPH and prostate cancer is crucial for effective management and treatment. Both conditions affect the prostate, but have distinct characteristics, risk factors, and implications for health. If you want to avoid prostate problems, it's best to start taking care of it right now. We encourage you to watch our complete playlist on prostate health for more in-depth information and tips on maintaining a healthy prostate. Remember, taking steps towards a healthier lifestyle can make a significant difference, whether you're currently facing a health issue or looking to prevent future problems. If you found this video informative, please like it, subscribe to our channel Health is Natural, and leave a comment below. Your support helps us create more content to keep you informed and healthy.